Directional microphones are used to help hearing aid patients hear better in noise by suppressing noise coming from some directions while maintaining good sensitivity to sounds arriving from another direction. This can improve the signal-to-noise ratio, which is important because every 1 dB improvement in SNR can improve speech understanding by about 10%. It is important to validate the effectiveness of directional microphones because if the hearing aid microphones are off by more than 10 degrees, a change of 1 dB SNR can occur. There are a few different methods that can be used to quantify the directional benefit, which we will discuss now. In a research lab, the directivity index is used to obtain a ratio between the output measured in the polar plot diagram at 0 degrees azimuth and the output measured in the polar diagram to all other angles. This directivity index correlates closely with the predicted movement in SNR from the microphone. However, this is typically measured in an anechoic chamber and requires specialized equipment to measure, therefore it is not usually measured in the clinic. Clinicians can evaluate the effectiveness of directional microphones in the clinic by using the front-to-back ratio or the front-to-side ratio, as we will discuss now. A front-to-back ratio is the frequency-dependent ratio in decibels of the output level of a hearing aid's response to a sound arriving at 0 degrees azimuth to the response to the same sound arriving at 180 degrees azimuth. This measurement can be performed with a test box or real ear system. An important point to note with the front-to-back ratio is that it is unknown if the ratio is related to performance with the device and if changes in this ratio result in meaningful changes in the clinic. The front-to-side ratio is a variation of the front-to-back ratio. Instead of the noise source being presented at 180 degrees, the noise is moved around for hearing aids with different null sources. If the front and rear microphones are no longer working in conjunction with one another, the front-to-back ratio will change and the system will not be providing the attenuation it should be. As stated previously, one way to verify the effectiveness of directional microphones is to use the test box directional test. To start, the audiologist will turn on the test box and make sure it is properly calibrated. This was done prior to filming. The audiologist should then insert the hearing aid into the test box under normal mode, using a coupler, as you see Casey doing now. In terms of couplers, it is important to note that when testing the left hearing aid, the left coupler should be used, and when testing the right hearing aid, the right coupler should be used. The clinician wants to position the hearing aid on the coupler the same as it would be worn on the client's head. Position the reference microphone over the front microphone opening on the instrument. It is important to note that for some instruments, other positions may be preferable. Here you can see the proper placement for a BTE instrument. And here you can see the proper placement for an ITE instrument. The clinician will then select tests, test box measures, and directional. Select test 1. This will present test signals from the front speaker and either the left or right speaker depending on if you are testing the left or right hearing aid. Speech will be used as the stimulus. During testing, 2 real-time curves will appear on screen. A stimulus level between 60 and 70 dB should be chosen to cause a separation between the curves to change over a 15 to 45 second period for adaptive directional mics. The audiologist will also want to select speech signal-to-noise ratio and select a signal-to-noise ratio from the list box. An SNR between 0 and 6 dB will usually cause a directional performance after 15 to 45 seconds. Click the check button to capture the curves or click X to stop the tests. Here you can see a better image of the two curves. As you can see, we ran 2 different curves, the first one at 70 dB and the second one at 60 dB. As you can also see, with each curve, there are 2 lines. The heavier darker line is the response to the front speaker signal, and the lighter line is the response to either the left or right speaker. If the instrument is non-directional, the 2 curves will be the same. If the hearing aid is directional, there will be a separation of the 2 curves. There is no separation in the low frequencies because this hearing aid is not providing any low frequency amplification according to how it was fit. If you do not find a separation between the two curves, there could be some reasons. These causes may include too high of an SNR level, an inadequate intensity level, incorrect hearing aid placement, inactivated directional microphones, plugged microphone ports, or the directional microphone just is not working. If the curves are reversed, the hearing aid may be placed backwards in the test box, or the wiring of the directional microphone may be incorrect. Furthermore, if the audiologist has previously tested this hearing aid before and does not have the same separation results, the audiologist should look to see if the hearing aid is placed correctly in the test box, if the hearing aid is placed differently in the test box, if the current coupling is not the same as past coupling, if there is a leak, or if there is debris in the microphone ports. This change may also be due to microphone drift. If the audiologist is using the older audio scan, the hearing aid would be placed differently. This photo shows that placement. As you can see, the hearing aid is attached to the coupler and would be positioned such that the front and rear microphone ports rest on an imaginary 45-degree angle line pointing towards the left speaker. The front microphone of the hearing aid should be closest to the left speaker. This ensures that the signal coming from the left speaker is directed at 0 degrees azimuth, and the signal coming from the right speaker is directed towards the null of a typical hypercardioid pattern. We felt that we should also mention that there are two different versions of directional testing that can be performed in the test box: noise and noise, or noise and speech directional testing. In the noise and noise condition, noise will be presented from both the front and rear speaker. In speech and noise testing, which is what we previously demonstrated, speech noise will come from the front speaker and noise will come from the rear speaker or side speakers depending on which test box you are using. Now we are going to look at how the audiologist would perform directional testing on a patient using on-ear measurements. This testing can be beneficial to see how the directional microphones are actually working when the patient is wearing the hearing aid.
Yep.
The patient will be seated facing the varipet at 0 degrees azimuth. The audiologist will insert the probe mic into the external auditory canal at the appropriate length. The hearing aids will then be inserted into the ear canal as well, making sure that the probe mic stayed at its appropriate location. It is important that the hearing aids are appropriately sitting on the patient in order to make sure that the front mic is seated where it should be. The audiologist will then locate the external speaker and place this 180 degrees behind the patient, as seen here. The front and back speakers should be located at an equal distance from the patient. The same testing procedure is then used for on-the-ear measurements as was used for the test box. Speech should be presented between 60 and 70 dB, and the SNR should be between 0 and 6 dB. The audiologist will again be looking for separation between the responses and will want to play the stimulus for 15 to 45 seconds. You can see testing taking place here. Here you can see a better image of the curves obtained for on-ear measurement. You can see that there is a separation between the lines as one would like to see. In addition to test box measures and on-ear measures, another way to evaluate the effectiveness of directional microphones is to use speech and noise tests. Speech and noise tests measure both omnidirectional and directional modalities. In the soundproof booth, the clinician will play both a target signal and a noise coming from a different direction at the same time. With a fixed SNR approach, a directional advantage will be calculated by measuring the difference between omnidirectional and directional percent correct. For a variable SNR approach, a directional advantage will be calculated by measuring the difference in SNR required to read 50% correct. Some examples of these tests include the SIN, the quick SIN, and the hint. This method might be used when the audiologist does not have access to a test box or real ear measures. We hope this video was helpful in understanding directional microphone validation. Thanks for watching.